Welcome to the deep dive. Today we're tackling a really challenging subject, fentanyl. It's this convergence of global supply chains, chemistry, and, well, some major regulatory gaps. And it's not just a crisis playing out elsewhere. We're seeing connections closer to home now.
That's right. It's a story with deep roots and increasingly global branches.
Exactly. And the trigger for this deep dive today was actually a recent scoop from the Nikkei Shimbun. They found a Chinese trading company based right in Nagoya, apparently acting as a middleman.
Exporting fentanyl raw material?
Yes, the precursors, straight to the U.S.
Wow. That's significant. It raises the worrying possibility that a major Japanese port like Nagoya could be serving as a transit hub, maybe without even realizing the full picture.
A transit base, yeah.
Yeah.
Funneling these chemicals from, say, China through Japan and then onwards, it complicates the tracking enormously.
It really does.
So our mission today is kind of twofold. First, let's unpack the history. How did the U.S. addiction crisis shift from prescription painkillers to these powerful synthetics? And second, what are the current risks?
Right.
Especially looking at global trade structures and, how Japan might be vulnerable.
Right. And to understand the fentanyl part, you absolutely have to go back to the first phase. Before fentanyl dominated, it was all about OxyContin.
OxyContin. That name became infamous, didn't it? It's a morphine-based painkiller.
Yes, morphine-based.
Yeah.
Made by Purdue Pharma. They weren't a giant, but a pretty respected medium-sized company, strong in CNS research.
Central nervous system, right.
Right.
So what was special about OxyContin?
Their big innovation was technical. They developed a sustained release formula. So one pill lasted much longer, maybe 12 hours.
Okay, longer effect. Sounds useful for pain management.
Exactly. On paper, it was for managing severe, constant pain more effectively. Think chronic conditions, really serious stuff.
But that's not how it played out, was it?
No, not at all. The problem was with the marketing. Purdue pushed it hard. They went directly to doctors, dentists, everyone.
And the message was?
The message was incredibly misleading. They claimed it was safe, effective for all sorts of pain, not just severe pain. And crucially, they claimed that because of the sustained release, it wasn't addictive.
That claim seems bold, given it's an opioid.
It was outrageous, frankly. Traditionally, opioids like morphine were really reserved for the most extreme pain, like cancer pain that doesn't respond to anything else.
Stuff like chronic back pain or post-dental surgery recovery.
Definitely not the original intention, but that's where it started being used thanks to the marketing. So you had this critical shift, doctors prescribing it for moderate pain.
And that led to?
Widespread chronic use, people taking it for months, years, and surprise, surprise, massive addiction problems starting really in the 2000s across the U.S.
The floodgates basically opened.
They really did. Eventually, things got so bad, high-profile incidents, public outcry. Regulators had to step in.
Oh, right. I remember reading about that. They tightened the rules.
Significantly. Around 2015, things really shifted. Made OxyContin much harder to prescribe and get. Purdue Pharma itself ended up facing huge lawsuits, mountains of legal trouble, and eventually filed for bankruptcy, reportedly.
So, problem solved. Less OxyContin, less addiction.
Well, it solved one problem. It reduced the supply of legal prescribed OxyContin, but it created a massive vacuum.
Because you still had millions of people dependent on opioids.
Exactly. Millions dependent, and their legal source just vanished. So where did they turn?
The black market.
Precisely. And the black market supplied an alternative, fentanyl.
So why fentanyl? Why did it become the replacement? Obviously, potent. We hear that all the time.
It's incredibly potent, yes, orders of magnitude stronger than morphine or even heroin. But the key difference is how it's made.
Okay.
OxyContin, heroin. They ultimately come from opium poppies. They're plant-derived, semi-synthetic. Fentanyl, it's a fully synthetic product.
Made entirely in a lab, no fields needed.
Right. You just need the chemicals and the know-how. And chemically speaking, its structure is relatively simple.
Meaning?
Meaning, if you can get your hands on the raw materials, the precursors actually synthesizing fentanyl it's not that difficult for someone with decent chemistry skills. It's efficient, cheap compared to cultivating poppies.
Okay, so it's easier and cheaper to produce illicitly. That makes sense. But what about controlling it?
And that's the absolute core of the current crisis. The precursors, the chemical ingredients used to make fentanyl, many of them are not currently regulated internationally.
Not regulated. How is that possible?
Because these chemicals often have legitimate uses, too. In pharmaceuticals, in industry, they're dual-use chemicals. So banning them outright is really difficult. It would harm legitimate businesses.
So if you get caught smuggling heroin It's clear-cut illegal.
Absolutely. But if you're caught smuggling, say, NPP or 4-ANPP, which are key fentanyl precursors, you might argue you need it for making something else entirely legal. It creates this huge gray area.
Massive enforcement loophole.
Exactly. And the U.S. has been pointing fingers, especially at China, saying they're the source of these precursors, shipping them to the U.S. or, more often, to Mexico, where fentanyl labs operate.
There have been diplomatic rows, threats of tariffs even.
Yes, and there has been some movement. Just this past June, China did agree to regulate 2 specific fentanyl precursors.
That sounds like progress, but maybe slow.
It's a step, but it's reactive, not proactive. And it only covers 2 chemicals out of potentially many variations.
Okay, let's bring it back to Japan then. The Nagoya case suggests Japan could be part of this supply chain. How is Japan handling these precursors?
Well, Japan hasn't regulated these specific precursors yet for the same reasons legitimate uses. The current approach is more administrative. They're asking trading companies, the shosha, to basically self-report suspicious transactions.
Voluntary reporting. Does that work?
Mm-hmm.
Especially given Japan's trade structure.
That's where it gets complicated. You see, in Japan, the chemical and pharmaceutical trade often involves multiple layers of trading companies. It's not always manufacturer directly to end user like in some other countries.
So one transaction might go through 2 or 3 different trading firms.
Easily. These shosha handle the logistics, the paperwork, the financing. It's historically how complex international trade has been managed in Japan.
But that creates opacity, right? Layers hide the final destination.
Precisely. Each layer adds complexity and makes it harder to trace where that chemical is really going. If you're the original manufacturer, you might sell it to trading company A, who sells it to trading company B. By the time it gets to the end user, the trail is pretty muddy.
Which makes a place like Nagoya potentially attractive as a transit point. It adds plausible deniability.
Exactly. It allows these precursor chemicals to move through the global system with less scrutiny. It's a structural vulnerability.
But it's important to contrast that with how fentanyl itself is handled inside Japan for medical use, isn't it?
Oh, absolutely. Domestically, Japan learned from the U.S. experience. Medical fentanyl use is incredibly strict. It's generally restricted only to severe cancer pain under tight control. Very different from the broad prescribing scene in the U.S. earlier.
So the controls on the final drug are strong.
Watertight. In fact, there are even strict rules about disposing of used fentanyl patches, the transdermal ones.
Why is that?
Because even a used patch still contains residual fentanyl. If someone were to misuse a discarded patch, it could still be potent enough to cause dependency or even overdose. They have to be returned, managed carefully. It shows you the power of the substance.
That really underscores the potency. And this leads us to the next, perhaps scarier part of this story, the analogs.
Right. This is where the chemistry gets really challenging for regulators. Fentanyl analogs are basically chemical cousins.
Meaning?
A chemist, often working for a criminal organization, slightly modifies the fentanyl molecule, maybe adds a small chemical group here, changes the bonds there.
And the result?
The result is a new compound, often just as potent, sometimes even more so. But because it's technically a different chemical structure with a different name, it's not on the list of illegal drugs, at least not yet.
So they're always one step ahead of the law.
It feels like that sometimes. These groups aren't just drug dealers anymore. They have sophisticated chemistry operations. They're using medicinal chemistry skills to design new psychoactive substances, aiming for high potency, cheap production, and crucially, being currently unregulated.
That sounds like a nightmare for regulators. How can you possibly keep up?
It's incredibly difficult. You regulate fentanyl. They make carfentanil, which is vastly stronger. You regulate that. They synthesize something like butanidazine or another analog. It's like playing whack-a-mole at a molecular level.
Trying to ban every possible variation before it's even invented seems impossible.
Exactly. The sheer number of potential analogs is huge. And then you have to consider the precursors for each of those analogs, too. It's a constant uphill battle for law enforcement and regulators worldwide.
The chemists can innovate faster than laws can be written.
That seems to be the dynamic, yes. And we have to keep coming back to the core danger. Fentanyl and its analogs are cheap, incredibly potent, and fiercely addictive. If these synthetics really take hold in a country, perhaps facilitated by these precursor supply chain issues.
Like the potential Nagoya connection suggests.
Right. If they spread widely, stopping it becomes exponentially harder than dealing with the OxyContin crisis ever was. The chemical genie is sort of out of the bottle.
So putting it all together, the U.S. crisis started with a regulated drug, OxyContin. where controls failed or were bypassed.
Yes, the initial failure.
That demand then shifted to a cheaper, stronger synthetic drug, fentanyl, which crucially was built from unregulated chemical parts flowing through global trade.
That's the sequence. A failure in pharmaceutical regulation created the demand, and loopholes in chemical regulation supplied the deadly alternative.
And the takeaway, the warning from our sources, seems pretty clear.
It's stark, really. If countries, especially major trading hubs like Japan, don't get serious about progressively regulating these precursors, the ones we know are being used, the ones we can control, they risk enabling this crisis elsewhere. Or worse, facing their own epidemic down the line.
It's not just about stopping the final drug anymore. It's about controlling the building blocks.
Absolutely. It requires a much more forward-looking, internationally coordinated approach to chemical controls.
Which brings us to a final thought for you, the listener. We see these criminal chemists getting better and faster at creating new, potent, unregulated analogs. So, looking ahead, what kind of international system could we even imagine that might actually protect and maybe preemptively regulate the next generation of synthetic drugs before they hit the streets? That's the incredibly difficult question facing global health and security now.